Welcome back, everyone, to our Impact Your Life channel in episode 4 in our pregnancy series, where we're going to be talking about upper body weight training. I'm Christie Amundson. I'm a physical therapist, and I'm also 23 weeks pregnant, and I'm going to continue to upload relevant content for pregnant and postpartum women on a weekly basis all the way throughout the rest of my pregnancy to help you guys out. So there are tons of benefits to exercising during pregnancy. Research has shown that women who regularly exercise during pregnancy have, on average, shorter labor times. They are less likely to develop gestational diabetes. They have less constipation and less swelling in their arms and legs. In addition to that, weight training in particular can help stabilize those joints that are getting really loose from your hormones, particularly the hormone relaxin that gets released from the placenta during pregnancy. That kind of relaxes those ligaments and soft tissues in your body to prepare for labor and for the baby to pass through the birth canal, but can kind of wreak havoc on your joints as a whole when you're pregnant. So strength training can help stabilize and support those joints. On the other hand, though, you have to be relatively careful with weight training because you are at increased risk for musculoskeletal injury for the same reason. So number one, you always want to check with your physician or the provider following your pregnancy or your postpartum period to make sure that they give you the okay to start any new exercise program based on your individual contraindications or whether or not you're high risk for pregnancy or your individual circumstances. So once you get that clearance, we're going to talk today about upper body only. I will be uploading in subsequent videos a lower body strength training as well as a core separately. But today we're talking all about the upper body, and I wanted to do something kind of quick and easy so that you can incorporate, even if you have a few minutes, the top 3 muscle groups that I think are most important for pregnant or postpartum women or nursing women for the upper body region. So number 1 would be your shoulder blade muscles, in particular your lower shoulder blade and kind of middle shoulder blade muscles. Those are the primary muscles that help to kind of pull your shoulders back and lift your chest. So as you I'm sure know, your breasts will grow and get heavier during pregnancy, and then in the postpartum period, after you deliver, they fill up with colostrum and followed by milk. And especially if you're planning on nursing, short or long term, then you're going to have a longer period where they're going to be larger and heavier. And typically, it kind of tends to pull our shoulders kind of forward, our posture into this kind of curved slouch posture. So that lower trap muscle is one of the primary muscles that helps to hold your chest up and your chest open and help you have good posture, eliminate upper back pain with those activities, as well as just help hold the extra weight of your chest that is acting upon your kind of upper back region. The second muscle group that we're going to target is your triceps, which kind of secondarily also help hold your shoulder and arm back, but they also are the primary muscle that when you're pushing yourself up are helping to lift your body weight. And then the last one is your biceps, which are the muscles in the front of your arms, which are the main muscles that if you're lifting your infant or your toddler, carrying, they're the main muscle that's helping you to lift and carry and hold that infant for a prolonged period of time. So those 3 are the main 3 muscles that we're going to go over. I'm going to show you some exercises first with bands. At home, if you have a band like this works just fine. If you have a band like this or a tubing like this, even if you could find a longer bungee cord from the garage, that will work as well. And I'm also going to show you an option with dumbbells. So I have 5-pound dumbbells here. Sometimes you just have to experiment with what you have at home. So if you don't happen to have dumbbells, look for some heavier soup cans. Usually do want to start pretty light. So I would start, if you're new to this, start with like 2 or 3 pounds maximum, and then you can build up from there. The most important part is that you can maintain a good position and feel the muscle working during the exercise. So let's go. Okay, so I'm going to show you the band exercises first. And all of the ones that I'm going to show you are going to be sitting in a chair. And that is because it is a very supported position during pregnancy. And it allows you to have the backrest to both support your back, but also to push against, which I really like. You certainly can do this in other positions as well. You just have to be careful about your position in any possible way that your body may try to compensate. So, first of all, when you're sitting, you want to be in a chair where your feet can be flat on the floor. So if you are in a higher chair, or if you just happen to be a little bit shorter and your legs you have to sit forward in the chair to get your feet to reach the floor, or your legs slope down to reach the floor, I would encourage you to put something under your feet, like some phone books or stool or something like that, to raise them up so that you can sit all the way in the back of the chair and your feet can be flat and your thighs can be relatively level. So all three of these exercises are going to start with kind of the same warm-up position, which is going to be your feet are on the floor. You're going to roll your lower back and push it back into the chair. Your chair should be pretty firm. It shouldn't be like reclining as you push back. But if I push back, I'm going to engage my abs. I want to still be able to breathe while I do that, so I'm not pushing really maximally or hard or holding my breath. But I'm going to push into the chair. That's going to make you kind of want to roll forward like this, which I don't want you to do. So you're going to push into the chair, and then you're going to take your shoulder blades and pull them back a little bit to set them. I don't want you to pull them back so much that then it pulls your back off the chair again. So you want kind of the best of both worlds, to be able to push into the chair, pull your shoulder blades back. All three of the exercises I'm about to show you start out with that same kind of, I'll call it a warm-up, but you're going to maintain that position throughout the entire exercise. So the first one is for that lower and middle trap, which is the shoulder blade muscles that help pull your shoulder blade back and around like this. So you're going to set yourself up so that you're facing your band and your band is above your head. You could tie a knot in the band or tube and then shut it in the door, or I'm using a hook. It just has to be above your head when you're sitting. When you put it on the hook, just make sure it's secure, and you also want to make sure, what I like to do is I like to wrap it around once like this, because I'm going to pull one side and then the other, and what I don't want it to do is seesaw. So I'm going to come closer, feet on the ground. I want to wrap my hands around the band, or if you have loops, you can use those if they're at the right height, but you do want them up above your head when you wrap them around. The reason I do that is so that you don't have to grip real hard on the band, because that tends to over-engage your neck. So same distance down, you're going to wrap your hands around, and you may have to experiment with how much resistance you have. So again, I'm going to push my back into the chair, and then I'm going to pull my shoulder blades back. And then I prefer that you go one at a time, but your elbow is going to come out to the side and down. And you notice my shoulder is not doing this. So I want your shoulder to stay down, and then it's going to go back up. And then you'll do the other side. I like doing one side and then the other, nice and slow. You want to go slowly both ways, and that way you get double the workout. You could do two at the same time. This is a little bit harder to maintain and not cheat and go like this. And I also find that it's a little bit more functional and useful for people to go one at a time, because generally, when we're doing things, not always, but generally, you usually are reaching with one hand at a time and not both. So it's a little bit more functional. So again, you're going to pull down, you're going to hold, you're going to keep breathing. So a good way to do this is to hold, breathe in, breathe out, slowly go back up. Other side, breathe in, blow out. So if you're holding and going slow, I would recommend anywhere from 8 reps or more. You can go all the way up to like 30 reps if you wanted to. Your shoulder blades are what they call endurance muscles. They're meant to hold your posture up for a long time. They're not meant to lift really heavy weights, so make sure that the resistance isn't super, super heavy. But if you want it to be really light resistance and you feel like you can't feel the muscle, it's not burning too much after 10 or so, I would keep going. You can go all the way up to 30 or even 50 reps as long as you're maintaining a good position. If you feel like your body's starting to fatigue or you're starting to compensate, meaning your shoulder's starting to come up or you're starting to arch your back, that would be a good time to stop. Also, if you're having pain anywhere, and not only in the area that you're working, but if you're having pain in your back, upper back, neck, anything like that, if you're feeling your neck up here really over-engage, you'll want to stop as well. So that's number one. Number two is your tricep, which you're going to, same thing, reach up, wrap around. So you can keep the same grip on the band. You're going to roll back, push your back into the chair so you feel your abs. Then you're going to pull your shoulder blades back and down. You're going to bring your arms down so that your elbows are at your sides. And I actually am up too high here. So that your elbows are at your sides. And then you're going to straighten your elbows like this and then back down. So again, I like going one at a time. So going right and bend, and then left and bend. You notice I am not actually, as I come up, I'm just bending my elbow. I'm keeping it at my side. I am not bringing it all the way up like this. So you can keep your arms kind of at your sides, shoulders down, and then the other side. And again, you can do that same thing. Lower up. So again, straighten, hold, blow out. Slowly come up, and then the other side. Slowly come up. Again, the whole time I'm holding my back pressing into the wall, or excuse me, into the chair, and my shoulders are staying down and back. It's one of the things that your body will want to do as it gets more tired is let your shoulder roll forward as it kicks your arm back like this. You want to make sure you don't do that. So you keep back as you straighten your elbow and then back down. Obviously, this works a little bit better if you have a chair without arms. But if you don't and you're using a chair with arms, just go on the outsides of the arms. So again, you can do two at a time, but I like it better to do one at a time. It kind of simulates walking. So it almost looks like I'm walking in the chair. Again, you're going to go slow, keep breathing. You're going to go same number of reps. You can at least, I would want you to at least be able to do 8 reps. If you can't do 8 reps without losing your form, then you probably want to decrease the resistance. So hold on a little bit lower, or if you have multiple bands with different resistances, you can drop the resistance on the band as well. The last one is your bicep muscle. So I'm going to flip around. This one you actually don't need the hook anymore. So you are going to actually step on the band. And if you wanted to, if you find that your feet can't hold the band down very well, you could wrap it around your foot, one or the other feet, to make sure it stays, because obviously you do not want it snapping back up in your face. So again, you're going to wrap the band around your arms, and it starts out the same way. You're going to rock back, push your back into the seat to engage your abs, pull your shoulder blades back, make sure you're looking straight ahead, not down like this, and then you're going to pull your arms up like this, and then back down. You're getting your elbows stay at your sides for this one. It is really also, again, with your shoulders, you're not going to want your shoulders to come forward as you lift, as you curl up like this. So you want to make sure to keep them back and down. And I do like, again, doing one followed by the other better than 2 at the same time, although you could do either. So again, you want to make sure that you can plant your feet hard enough that you're not seesawing the band. back and forth if you're doing the alternating right to left. You could do both at the same time as well. Again, the biggest thing is keeping your back against the chair the whole time so your abs are engaged, as well as keeping your shoulders down and back as you do it. It's very important that we train this bicep muscle in a way that is using your shoulder blade muscle as well, because when you're going to be wanting to lift and carry around your infant, you don't want to start getting into this position as you're holding them, because that muscle back there is getting fatigued, because that is going to kind of wreak havoc on your neck and upper back. So we want to train in a position that you're back and down with that shoulder blade, and then working the muscle so that it learns how to become strong in that position. All right, now I'm going to show you those same 3 muscle groups, but with dumbbells, if that's what you have at home. Okay, so now I'm going to show you the same 3 muscle groups using dumbbells. Again, I have a 5-pound dumbbell. That's just what I happen to grab, but I would start low if these are new to you. Start like a 1 or a 2 or a 3-pound max weight, and then you can build up from there depending on how it's feeling to you. The good part about the dumbbell exercises is there's 3 muscle groups, but actually I'm going to combine the first 2 into one exercise. That's a combination exercise. So there's actually only 2 exercises for the dumbbells that incorporate all 3 things. So the first one you have to do in kind of a modified hands and knees position. And usually if you use your couch, if it's firm enough, now if you're really, really sinking, you might have to try to figure something else out. If you have a bench at home, or 2 chairs would work too, hand on one chair, knee on the other chair, maybe with a pillow underneath it. You want to try to get the height as close to, if you were to put your knee and hand on it, as if my back is pretty flat here. So I'm not like really kind of kittywampus like this or like this. One side is really higher than the other. So when you stand on your leg and you bend your other leg, basically you want the height of whatever you're using to be around your knee height, so that when you bend your knee and rest on it, it ends up with your pelvis and back pretty level. So I want your toe to point straight. Your fingertips are going to point straight too. If this is too much for your wrist, you can do this if you prefer. Or you could also prop yourself up a little bit more on some pillows or on a laundry basket or something, and use your elbow on here too if that's too much for your wrist. But you're going to hang your dumbbell down like this, kind of the equivalent to what we were doing in the chair earlier. You're going to round your back, so you're going to engage your abs a little bit. When you round your back, it's like you're pushing your spine up toward the ceiling like a rainbow and tucking your butt under a little bit. Then you want to make sure that the hand that's supporting you, this shoulder, is down, not up toward your ear. And the arm that's hanging down, your shoulder also should be down. And what you're going to do is kind of like a row. So you're going to round out, and I'm going to pull my elbow back to my body. When I do that, my shoulder here is going to want to go forward like this, but you're not going to let it go forward. You want it to go back. So you're here, round, you're going to pull, keep your shoulder back, hold it there, and then you're going to straighten your elbow. So this is the combination part, and then bend it again to 90 degrees, and then lower it down. So we get kind of a row for your middle trapezius in your shoulder blade, and then by kicking it back, you get your tricep. And then bend, and then down. Obviously this, you don't have an option to do 2 at a time, just 1 at a time. The biggest thing with this is keeping your back rounded and making sure that as you do this, your shoulder stays back, both when you row and when you kick it back like this. And then back down. So then you would flip around and do the other side. Again, this one is a little bit more challenging because gravity is acting on your arm as well as the weight. So even with a 5-pound weight or a 3-pound weight, it's actually going to be a little heavier than that because gravity's pulling on it as well. Then the other exercise is going to be sitting again with your dumbbells. So same as before, you're going to roll back, push your back into the seat. You're going to pull your shoulder blades back, head straight, not down. And then you're going to curl with your elbow at your side, curl your kind of palm toward your shoulder. And then the other side. Again, you want to alternate if possible. You could do both at the same time, but I find that alternating is much more functional and better for your body as long as it doesn't bother you. When you're doing this, make sure that your shoulder doesn't come forward and try to kind of kiss your palm. So make sure it stays back. Again, you're keeping your back pushed back the whole time. And you're breathing as you do this. So that's the dumbbell version of the bicep curl. So if this was me and you have, let's say you have dumbbells and bands available to you, if it was me, I would probably combine the band pull down for that lower trap first, and then I would do the row tricep that I just showed you, and for the bicep I would do it with the dumbbells. So I would choose for my 3 exercises basically the 2 that I just showed you plus the pull down with the band if you have both available. But certainly you can do however you want. And if you wanted to do more for your upper body, you certainly can. I would highly recommend adding these 3 muscle groups into your program, and by using these exercises or any other ones, as long as you're careful that you're not compensating. Thanks so much for watching, and we will see you next week. Please give us a like if anything in this video was helpful to you, and subscribe for more content. Thank you.